Welcome to episode 36 of America in Crisis, Breaking the Cycle of Addiction. My name is David Hunt and I am your host. Please set your DVRs to record. The show could save your child's life. According to Middlesex District Attorney Marion Ryan, as of July 5th, 2023, there were 115 opioid-related deaths in Middlesex County. Our guest today is Dr. Omar Shah. Dr. Omar Shah is an adult, child, and adolescent psychiatrist and addiction medicine specialist. He currently serves as full-time faculty at the Harvard Medical School and as a psychiatrist at Boston Children's Hospital. He is a Ruth Fox Scholar of ASAM, American Society of Addiction Medicine, and a recipient of the AAAP, the American Academy of Addiction Psychiatry, John Renner Award. He served as the vice chair of the APA, American Psychiatric Association Leadership Fellowship, and was recently awarded the APA Resident Resignation Award. He completed adult psychiatry training at the Delaware Psychiatry Residency Program, his child-adolescent psychiatry training at the Geisel School of Medicine at Dartmouth College, and a fellowship in addiction medicine at Boston Children's Hospital, Harvard Medical School. Dr. Shah is interested in working with patients with complex psychosocial burdens and families with substance use. Doctor, welcome to my show.
Thank you so much for having me, David.
You're welcome. Thank you for coming today. First question. I saw your bio. Oh my God. How long have you been in the field?
You know, I've been in the mental health and addiction field for almost a decade. I have been at the Adolescent Substance Use and Addiction Program at the Children's Hospital for around a year.
Okay. What exactly is the ASAP program? What can you tell us about that?
The best way I would describe it is it's a premier treatment center where we evaluate adolescents and children for substance use. And this could be teens who are just beginning to use substances all the way to teens who are struggling with severe addiction. We provide comprehensive evaluation, individual therapy, group therapy, education to families, in addition to medications.
So it's not just you have a team behind you.
Oh, for sure, yeah.
And how big is this team?
I would say we're between 15 to 20 members who are core members. Our team is comprised of addiction medicine specialists. That includes providers with different primary specialties like family medicine, psychiatry, pediatrics. We have a nurse practitioner on our team. We have master's level social workers and addiction medicine fellows. What that means is they're physicians who are training to become addiction medicine specialists.
And what ages do you cover? I mean, is it for kids? Is it for old men? Who can come to who's this team help?
Yeah. So, I mean, we would love to treat everyone, but this is Boston Children's Hospital, right? So we treat patients from ages 11 to 22. However, if patients want to stay longer, they're welcome to. In fact, we have some patients all the way up till age, even into their 30s, but not that many.
Do you see kids that are younger than 11 trying to get in?
I have not so far.
Thank God for that.
Yeah.
Even 11's kind of bad.
Oh yeah, it is. But we try to get them in early, and we try to educate them as soon as possible.
Now, do you also help their families, or does the child come in on his own? Is this a family thing, a counseling?
Yeah, for sure. So addiction is not just an individual issue, it's a family issue.
Now, obviously, there's a show about drugs. I wanted to bring you on as a doctor. I've had many guests on, but some people, they seem credible. Some people, they think, oh, they're embellishing. You're a physician, you're a doctor. You're a man who knows. What actually happens to your brain when you are on drugs? What does this do to you?
Yeah, I mean, it's a very deep topic, but I'll try to be brief. There are many ways in which drugs affect the teenage brain. To have a better understanding of this, I want to tell you the definition of addiction according to the American Society of Addiction Medicine.
Yes, please.
And let me just bring that up here in my notes. So, verbatim, addiction is a treatable chronic medical disease involving complex interactions among brain circuits, genetics, the environment, and an individual's life experiences. People with addiction use substances or engage in behaviors that become compulsive and often continue despite harmful consequences. So hence, we can see from his definition provided by ASAM that addiction is affected by several aspects of our lives. There is the social component, the genetic component, individual life experience, and of course the neurobiological component. There are several parts of the brain which are, we call them like they're the pleasure centers of the
Yes.
brain. So for example, the nucleus accumbens is one and the ventral tegmental area is another.
Can you point it? We get a brain photo.
Yeah,
Can you point some of that for us? Do you mind?
for sure. So these are actually some of the parts of the brain which are affected by almost all drugs. So this is the prefrontal cortex right here. This is used for executive functioning, focus, attention, and then also like organizing your day. And then this part would be the nucleus accumbens, and the amygdala should actually be around here somewhere. So that's a little inaccurate. But and then of course this is cerebellum, which is we use that for coordination, walking, just helping us balance ourselves. And of course, the whole brain gets affected, but these are just some areas I want to point out.
Yeah, please, if you go, okay.
Yeah.
What exactly does it do to the brain?
Sure.
Say I have a hit of cocaine. What's that going to do to me right now? If I was to snort cocaine right here in this building, what is going to happen to my brain?
So, so with cocaine, there are many effects which are immediate, right? For example, your vision gets blurry, your heart rate increases, your blood pressure increases. You know, if you overdose or take too much, you can die of a cardiac arrest or a heart attack, which is the most common way to go actually when you overdose. But developmentally, so this is important to know because during the school age years, which is around ages between 5 and 9, right? This is a time when children are learning to differentiate between rewards and develop goal-directed behavior. So the thing is that, for example, as you said, what are the effects of cocaine, right? So for example, if a child receives an A+ grade, right? This makes him or her happy. Their nucleus accumbens is stimulated by dopamine and they have euphoria. So this is like a positive reinforcement and positive feedback that children get, and then they want to do better next time so they can get a good grade and feel good, right? So this is normal goal-directed behavior. However, I will give you a striking example. Let's say you give the same kid cocaine, right? Just to make it easier to understand addiction. So imagine the kid snorts cocaine. Cocaine itself is a very potent stimulant, provides a very intense euphoria. Normal everyday rewards like getting a pat on the back by your coach, love, hugs from your parents, or getting even an A+, it can't compete with cocaine. So the thing is that cocaine and these drugs are very powerful. They hijack your brain, and in order to get that feeling of intense euphoria again, and to avoid feeling terrible, people develop drug-seeking behaviors, and this is because their main goal becomes getting that high again, right? And so addiction becomes understandable when you understand the neurobiology behind it. And so why would a kid want to work hard to achieve something which gives him or her pleasure when all they have to do is simply use a drug? It's fast acting, it feels good, and there's no work involved. So, and lastly, I want to say oftentimes teenagers can turn to drugs in times of stress or depression. Drugs give them temporary relief. Once the effects of drugs wear off, people realize the problem is still there and has not gone away. So drugs just mask the issues, and thus a vicious cycle starts.
Now, I understand that. I've never used a drug. So if hypothetically right now I was to take a drug and it's the best feeling in the world.
Sure.
It's like on a scale of 1 to 10, it's a 12. This is the first time.
Okay.
Why can't I ever repeat that again? I can take the same dose tomorrow and the next day. Is it true I will never get that 12, 13, 14, whatever I got? I'm going to be down like a 5 or a 6 in search of that endless high. What happened? Why can't I ever get that again?
Yeah, that's a good point you bring up, David. So the thing is that it comes down to neurobiology, of course. So amongst, of course, other aspects that I mentioned, like social and emotional. But the thing is that when you take drugs, right, if they feel good, so your receptors increase in number so they can absorb the drugs, right? And the thing is that over time, when you keep taking the drugs, what the brain does is to protect itself, it down-regulates the receptors. What that means is they die off. And then when you use more of the drug, it doesn't have the same effect because there's no receptors there to absorb the drug anymore. And eventually even the dopamine which is released in the brain gets decreased.
So parts are dying off.
Yeah, the receptors die off. But the good news is that once you're abstinent from the drug, new receptors grow, and they're naive to the drugs. So the caveat is, a lot of times people psychologically are using a certain dosage of drugs, and then when they're abstinent for a while, they go back to using the same dosage, and that's when you see the overdoses.
Yeah, correct.
Especially like cases of cocaine overdose where they do, have a heart attack and die.
I actually know someone that was on heroin for years, and he stopped for about 7 years. He was clean. He met a girl, and she was our user, and he tried, and he remembered the same dose he used to always do. He put that dose in, and he was gone. He overdosed on his first dose, and whatever amount he took, that's what he was used to back then. Or when people get out of jail, they get away for 30 days. Now they have to be clean. They can't wait to get back out onto the street. As soon as they get on the street, oh, I took this much of a dose. This is nothing. I'll take the same dose, and bingo.
Yeah, unfortunately, that's just human behavior. You know, we do what we know. So, yep.
Okay, let's go. We're going to go all the whole list of the other drugs a little bit later. I want to get into the brain right now. What does marijuana do to the developing brain? I mean, this is the most common gateway drug right now. Now that marijuana is legal, people are trying it, and of course they're not going to be happy with it. They're going to go to something else. Because, well, if marijuana is good, coke must be better, and then heroin must be even better than that because it costs more. So, and all my friends are doing it, so I want to try that next. So, what does this marijuana do? When I grew up, it was illegal. I wouldn't try it, legal or not. But what is it doing to people when they're taking it?
Yeah, so, you know, first of all, I just want to say that marijuana back in the day, like 70s or 80s, is way different from how it is right now. So the THC content, which I'll get into in a little bit, is way more than before. For example, the THC content, which is the psychoactive ingredient of marijuana, used to be around up to 4%, 2 to 4%. Now it's 25% and above. And that's not a good thing because THC, it's psychoactive. What that means is it can cause symptoms of psychosis like hallucinations, paranoia, anxiety, that sort of thing. So cannabis is very much associated with schizophrenia and bipolar, and in fact, indeed, depression and anxiety in the long term. To answer your question about marijuana's effect on the developing brain, we have to start with a little bit of background here.
Okay, please do.
And I'll try to be brief, but it's important to know this, because if people know this, then they can understand the detrimental effects of marijuana, right? So the thing is, marijuana or cannabis has many ingredients, and I'd mentioned one of them, which is THC or tetrahydrocannabinol. And then the other major component is CBD or cannabidiol. So these are known as exogenous cannabinoids. Why is that important? Because in our brain we have these things called endogenous cannabinoids, which the only difference is they're natural cannabinoids in our brain. They're natural, they're healthy. That's what our brain is making. They include things like anandamide, 2-AG, and NAE. I'll talk a little bit about anandamide. So anandamide is the endocannabinoid which has the most impact on our brain. It's also known as the bliss molecule. That means that it's released after we do things which are very important for functioning, for our biology and evolution, such as, you know, laughing, dancing, you know, just any sort of joyous occasion we can enjoy. And the thing is that think of the anandamide system as a volume dial, or the endocannabinoid system as a volume dial in our brain. It's the way we react to the environment. So the thing is, when things get a little too hectic, it dials down our brain and brain activity and helps us calm down. However, when you smoke cannabis or marijuana, what happens is the THC comes into the brain and it hijacks the brain. How does it do that? It's super similar, the structure of THC and anandamide. So what it does is THC replaces the anandamide. So now THC is in control of our brain and not anandamide. And the thing is that there can be too much excitation of brain cells, which leads to cell damage and death. And of course, as I mentioned, THC can cause psychosis and anxiety and depression. And as you can see, these changes can affect the brain's chemistry and ability to regulate mood and feel pleasure, etc.
So let's back up a minute for a second here. Whoa. It causes death?
Brain death, yep.
Why does this stuff
a neuronal brain death, yeah.
Why does this stuff become legal?
The thing is that, you know, some people just, well, there's many reasons for it. of course, people feel good when they use marijuana. It does help certain people with seizures, which are uncontrollable with normal medications, right, or regular medications. It does help people in severe pain who are chronically ill and who may have life-threatening medical issues going on. So in those situations, it's FDA approved. It makes sense,
absolutely,
right?
in those.
Yeah, I mean, totally understand that. However, it's also it makes a lot of money for society. It does. I mean, I can't just not say that. It does. And so it's a big business, just like nicotine was, cigarette smoking is or was, and now vaping has replaced cigarette smoking. So marijuana is a very big industry, and I believe 22 states have legalized it. But yeah, that's where we are right now.
And they probably don't give you the warnings. I remember when a soft drink, actually it was a bottle of water, came out years ago, they found a little bit of benzene leaking off of the glass. But it wasn't, quote, pure spring water. And they recalled, I'm not going to say the name, but you guys can Google it up. But just because it wasn't pure spring water is on the label because glass has benzene, it was leaching in, can't call it pure anymore. They recalled millions and millions of jars of water. Not that the benzene would hurt you just because it wasn't pure as advertised. But they can give you marijuana and...
Yeah, the issue with marijuana is that once you legalize it, the thing is, it's much more accessible for kids because adults are using it. And then evidence shows that in the states where it is legalized, up to 25% more kids are using it. It's just more accessible, it's easier to get, and once parents use it or adults use it and the kids see that around them, they're more prone to using drugs.
And don't you feel, a personal opinion, that if they're using marijuana and, oh, this is good, oh, my friend is using heroin, this must be better. Do you think it's going to say, let's try something else?
Oh yeah, for sure.
Or I get bored, I get bored with marijuana. What else? There all these other drugs out there, let's try something else.
Yep. In fact, I'm so glad you brought that up. So marijuana is a huge gateway drug, and so is nicotine or vaping nicotine. So research shows that once you use one of these drugs, you're more prone to using more and more drugs. So a lot of times kids may start vaping nicotine or marijuana or cannabis and just think it's a benign, everyday thing and not make a big fuss about it. But then these same kids may have almost 8 times more chance of using heroin or opioids and becoming addicted to that.
Audience, forget you heard him say the word vaping. You don't know, you're coming back on another show.
Okay, I would love to.
I actually spoke to the doctor obviously off camera when we were preparing this, and there's so much more has happened in vaping since the last time I was out here with another organization. And I want to hear it now from a physician. We've heard from another organization, the Lung Association, and they had great information, but we actually have a doctor that can tell you what vaping causes and so much more details. So you will be back, and we will be having another show on vaping. Sure. I feel that kids nowadays, especially kids that just graduated, so many kids are vaping thinking there's nothing in it that's going to harm you. And there are so many chemicals, as you know, that's in it. Yeah. So that's going to be a show on its own.
Sure, yep.
So don't vanish too far. Okay. Opioids, which is actually the reason I do the show, because I'm with District Attorney Marion Ryan's Opioid Task Force, which is a group of individuals, law enforcement, counselors, social workers, and other facilities that are there to help people. And that's how I got involved in this with opioids. What can you tell me, first, what is an opioid and what kind of damage can that cause? We'll roll it into one big long question.
Sure. Opioids are powerful pain relievers, and they're the most powerful ones available. They produce a euphoria or a high. They're highly addictive. People who become addicted to opioids find it difficult or nearly impossible to stop without support. Opioids decrease breathing, decreases heart rate, and in high doses, people can overdose, and it's very lethal. Opioids include painkillers or pain relievers such as OxyContin, Percocet, Vicodin, etc. And then, of course, there's the natural forms, which we call opiates, such as heroin, morphine, codeine. And fentanyl is a big one out there these days. In fact, I would say we live in a fentanyl era now.
Yes.
The game has changed. Even treatment has changed because of fentanyl. It's just so potent and binds so tightly to the receptors in our brain that we've had to really step up our game when it comes to treating patients with opioid overdose.
And I understand that because it's fentanyl, won't release if you use Narcan because you got opium or heroin, Narcan will release the receptor that attaches to the molecule. But you mix it with fentanyl, you're not going to get that same positive result. Am I correct on that, doctor?
Definitely. So there have been cases where we've had to use 3 or 4 Narcan doses instead of 1 because of fentanyl. That's how TALI binds to the receptors.
So basically, I got to worry about drowning on the operating table from the Narcan than from the drug.
Yeah, and also I just want to put this out there. Overdose deaths have actually overtaken accidents in the youth, first time in history. And also fentanyl is responsible for at least more than 70% of those deaths, and 1 pill can kill. So a lot of times you might see, a teenager trying a pill for the first time in their lives just for fun or something, a party or whatever, and they take a pill and they die. And this is huge. It's a huge problem we have.
Now I'm going to bring up something that's basically going to scare the living daylights out of the emergency room doctors, the ED department obviously, and the ambulance EMTs. We've mentioned opium, we've mentioned heroin, we've mentioned
Fentanyl.
I'm sorry. We mentioned fentanyl.
Yeah.
New word, Xylazine, also known on the street as trank. It is an animal tranquilizer. Can you overdose on Xylazine? He's not going to answer it because he's the doctor. I'm asking my audience. Can you overdose on Xylazine? It's a trick question. No, you can't. The doctor's like, what am I talking about? What do you mean I can't overdose? The reason you can't overdose, it was never dosage to you in the first place. An overdose is taking an excessive amount of a drug or a medication or an illegal drug that you're not designed for that dosage, and you will overdose. Well, guess what, people? You're not an elephant. You're not a hippo. You're not a large horse. You can't overdose on something that was never given to you in the first place. Xylazine is coming in on 9 out of 10 fentanyl cases. Fentanyl is linked to your opium and on your heroin. It's not supposed to be, but it is. And now 9 out of 10 doses of fentanyl are coming in with Xylazine. Doctor, why should that be scaring the living crap out of your emergency department?
For sure, because we're having people come into the ED overdosing, and now a lot of them are dying despite treatment, just because of the potency and binding capacity of these new synthetic drugs out there.
I mean, I'm about 130, 140 pounds, give or take. Why should I worry about Xylazine that's made for a 2,000-pound elephant?
That's exactly why. It's not made for you. It's made for something much larger with much more body mass, which can actually take it and not overdose on it. And
this is coming now all over the country?
Oh yeah, yeah. There's even more drugs out there which are even more potent than fentanyl and Xylazine. It's very scary. And in fact, the amount of fentanyl you can find in the U.S., just the U.S. alone, can provide fentanyl for the whole world over. And this is just the U.S. alone. So imagine other countries out there, right? Because it's cheap to make, dealers want to make money. They don't really care about the consequences. It's cheap to make. They put it into everything. Almost everything is laced with fentanyl these days. Yeah. That could be vape pens. That could be cannabis. It could be heroin. You name it.
So if you're buying marijuana on the street, which is my favorite term till someday I get sued for it, cannabis does not have the good housekeeping seal of approval with a little check mark. You're buying it from dealers that are putting this stuff together. Bottom line, now it can come in, is fentanyl attached to it?
Yeah, we don't know. Yeah, and in fact, that's one of the reasons we do random drug testing at Boston Children's Hospital. Also, first of all, it helps us monitor patients, but it also helps us keep them safe, because a lot of times we can find fentanyl positivity in the drug screen results. And
in the real drugs, in the medication that's approved.
Yeah, or like they might have just vaped on one occasion, and then we find fentanyl in there, and we call the parents and the patient right away.
And I'm not going to say the name of the pharmacy. There's a very big pharmacy out there, and they're doing nothing wrong. They're buying their medication from a reliable source, but sometimes that source gets a fake pill or something that's been made in a lab, and they think it's the correct medication.
Yeah, it's hard to tell. I mean, they look just like the real thing. Really, it's very difficult to tell now.
Okay, we have covered fentanyl, we've covered marijuana quite extensively. Let's go into inhalants. People nowadays, they're not doing inhalants as much. They haven't heard of them. In my days, people were sniffing everything. I think the big thing back in the old days was locker room. Yep, I just dated myself, people. The older people know what that is. It's an inhalant. What can you tell me what an inhalant is nowadays, how it affects the brain?
Sure. Inhalants are chemical vapors found in common household products such as lighters, whipped cream,
Yep.
Whipped cream cans, keyboard cleaners, glue, spray cans, felt pens. So inhalants are often used by younger teenagers because these products are easy to get, and they can use them without arousing suspicion by adults. Most inhalants produce a rapid high that resembles alcohol intoxication.
Okay.
If a sufficient amount is inhaled, nearly all solvents and gases produce a loss of sensation and even unconsciousness. A single use of inhalants, if high enough of a dose, can be lethal.
Everything is the term huffing. Am I correct on that?
Yep, yep.
I am correct. Okay.
Yep.
The other day down by the rail trail, this is true, down by the rail trail behind the old 7-Eleven in Woburn, there's about 10 cans of whipped cream over by the trail, which is right behind where 7-Eleven goes, which is now Montfilmont. 7 to 10 cans. I'm walking the trail like, what's all this? And my friend that was walking with me, she didn't said, oh, why would they dump whipped cream here? I'm like, no, that's not whipped cream, they are huffing.
Yep.
So it's horrible. Like imagine what that 7 cans did, or how many kids. Hopefully it was a bunch of kids using it, passing it around.
Yep.
But one kid with all that on their brain. Doesn't that burn out the brain cells?
Oh yeah, for sure. It can really cause severe brain damage, for sure. Yep.
And they think this is a good idea. Why?
You know, I feel like we just have to get the message out there and the education out there. A lot of kids don't realize what they're doing. That's what I feel.
I didn't even know they were still doing it.
Yeah, yeah.
Amphetamine. What are they, and what do they do to the adolescent brain? We're hearing it from a doctor. We're going one by one on every drug we've had on this show of missed. But to get it from a true source, from a doctor, with no ulterior motive, no trying to get you into their treatment facility. The man treats people. He doesn't own a house. He doesn't own a sober living house. He has no reason to be here other than to explain what's going on. So I want to hear this. Amphetamine from a doctor.
Sure. You know, amphetamines, in basic terms, they include prescription medications which are used for conditions like ADHD, such as Adderall, Ritalin. These are known as stimulants, these medications. Yep. They help to improve symptoms such as inattention, hyperactivity, impulsivity. So what happens is that teens, when they prescribe these medications, they may trade them with other kids or sell them because you can make a little bit of money doing that,
oh, yeah.
right? The thing is that it's good when you use it as prescribed. However, if you don't use it as prescribed, it can cause many issues, such as cocaine, right? Like,
yes.
But at a lower level, I guess. It can cause increased heart rate, increased blood pressure, cardiac issues. People can crush them and snort them, and that's when it becomes very dangerous. Of course, it's very addictive. And the thing is that, just a point I want to make out there is that if someone who doesn't have ADHD uses amphetamines, it doesn't really help them long term for the symptoms of ADHD because they don't have ADHD.
So it's more dangerous than swallowing the pill going through your system. By crushing it, it goes right into the bloodstream.
Yep.
That's not good, is it?
No, it's just much more faster acting, and it gives a more of a high. So that's why people do it.
Okay. Now we've talked about cocaine a little bit earlier. Is there anything else you want to elaborate on cocaine that you may have missed, or something you thought about while we were talking?
Yeah, I mean, cocaine, you know, it's a very addictive stimulant drug. It actually comes from the coca leaves, which are native to South America. So what happens is those leaves are processed into cocaine hydrochloride, and that's why you find like the white powder form, which is, you know, shown on movies and media and stuff, and that's what people snort. So you can snort it, ingest it, inject it even. It's used medically for local anesthesia, and which is that's a good purpose, right? But as a street drug, it can be very dangerous, causes euphoria, you know, increased heart rate, blood pressure, hyperthermia. What that means is the body temperature increases. That can be lethal for you. And as I mentioned earlier, most people who overdose on cocaine die of heart attacks.
Wow. Isn't the phrase the narco subs?
Yep.
What I mean by that comment I just made is when it comes over Colombia, so it gets avoided, undetected by the Coast Guard, they have little miniature submarines. But this stuff is so profitable that the drug manufacturers can actually buy submarines to sneak it in. And a narco sub could have something like, I know I'm wrong on the number, 50, 60, $70 million worth of street value. Figure a submarine filled with the cocaine. What's it cost for a little drop of vial of cocaine? $50, $60. I have no idea the street price. It's somewhere up there.
Even more higher probably. Like, it's a quick way to get rich, but then a lot of people die in the process, right? And the thing is, it's easy to mix cocaine with, I mean, these people are very, they use very different methods or genius methods, I guess. They mix it with cornstarch, talcum powder, et cetera, and it's hard to sort of detect cocaine. So that's how they're bringing it into other countries and smuggle them.
Do you think they're using it in the Boston area? Are they using it enough in Boston, or is that sort of waned away? I know it's a Hollywood drug, it's a designer drug. Now the heroin's out there. Have you seen a decrease in your area?
Yes, that's a good question. I'm not sure. I know it's still pretty common,
It is, okay.
but vaping and cannabis have truly taken over, especially in the youth, for sure. In the youth, it's definitely nicotine, cannabis, and alcohol.
We can sneak it in. It's a vaping cartridge. Looks like anything.
Yep.
In fact, now it looks like thumb drives and everything else.
Yep.
Okay, ecstasy, also known as E. What is it, and what are the effects on the human brain?
Sure. So ecstasy is also known as MDMA.
Okay.
It can be known as Molly. It's a synthetic drug that produces energizing effects, psychedelic effects. It's referred to as a club drug because people tend to use it at bars, nightclubs, raves.
Raves,
That's
exactly.
very famous for it. When people take these drugs such as ecstasy, what happens is they have this mental stimulation. They develop this emotional warmth or empathy, right? And they feel like, we're full of love now, right?
It's the hug drug.
Yeah, it's like exactly. And the thing is that, but there are also other effects of ecstasy which are not that good. It can cause seizures. It can cause hyperthermia, such as cocaine, where your body temperature goes up. And it can go up pretty rapidly. So imagine a teenager dancing in this hot club because there's so many people around.
Yes.
There's so much warmth around, and plus the ecstasy is causing them to become even warmer. So your body temperature can go up pretty fast, and your organs can shut down. So it can be very dangerous.
You're sweating, you're dancing. Look at all the liquid you're getting in. Oh, wait a minute, that's alcohol. That doesn't help. That actually hurts. It's diuretic.
Yeah.
So if no one's going to get a glass of water. They're going to reach for their club drink, which is a diuretic because it's alcohol. Yeah. So as an EMT, if we have someone down, the thing is, when was the last time you drank anything? Oh, I had a couple drinks of Jack. I had some whiskey. I had some this. I had some club drink. No, when's your last water intake? Oh, that was 5 o'clock today.
Yeah.
And you're over there sweating, drinking a diuretic, which is going to make you pee it out, is the best way of putting it. And you're sweating, and you're dancing, and you're doing E. Great combination, doctor, isn't it?
A lethal combination, I would say.
So that's not good.
Yep.
Now, methamphetamine, also known as meth. What is meth? Crystal meth, the whole 9 yards. You can talk about the whole 9 yards. Let's name them all.
Methamphetamine, of course, is very popular because of course, media and Netflix doc series, and of course, we all know. It's a very addictive stimulant, closely related to amphetamine, much more powerful, I would say. It increases wakefulness, physical activity. It can also produce increased heart rate, blood pressure, et cetera, just as cocaine does. It can also cause a lot of agitation and aggressive behavior in people who take it. It can cause psychosis, hallucinations, much as the other stimulants can too, such as amphetamines and cocaine. Methamphetamine, people who start using it, it hijacks their brain. They don't think about anything else. It's just their motivation is just to get the next drug. I've heard many cases of adults driving cars at rapid speeds with babies in the back.
Yeah.
And not that they mean it, not that they're bad parents. It's just they've been hijacked by the drugs and they just don't know what they're doing at that time. It's horrendous. I'm
on meth, hypothetically.
Okay.
Why am I pulling bugs off my body that aren't there? What's going on here? Why have I got sores? Explain to me, why am I pulling bugs?
Yeah, like I said, it hijacks the brain. It stimulates the brain so much So you can develop symptoms of psychosis. You can, that's called tactile hallucinations.
Yeah, please, if you could get into that area.
Yeah, so, it says auditory hallucinations, visual, tactile. What that means is you feel things creeping up your skin which are not there.
Okay.
But you feel it, so it's real for you. So it's sort of like a delusion, and you can actually feel it also. And that's what these drugs can do, such as methamphetamine.
So I'm trying to scratch it off and there's nothing there, so I'm still scratching.
Yep, and it's all just psychological.
Now, the dentist friend, crystal meth. Let's go into the real good stuff.
Okay. So crystal meth, it's a white, odorless, bitter tasting powder. And the thing is that it's sort of like a rock, crystal rock, which is people heat it and they can smoke it. And the reason it's even more potent than other forms of methamphetamine is because it works really quick. You inhale it, it gets to the brain real fast. You get a quick high, very severe, very intense high. And so that's why a lot of people prefer using it. And the thing is that it may feel good at that time, but it's also way more lethal.
And it's so addictive, I understand that you'd almost kill for it. If I'm a kid, my parents aren't lending me money, I would empty that house. Everything they own, I would empty and sell.
Yep.
And think nothing about going through my parents, even robbing my parents right there on the spot, because you need that fix, you need that high, you need it right now. Not 10 minutes from now, you need it now, and you're standing in my way.
It goes back to the whole developmental, neurodevelopmental stuff I was talking about in the past, where kids, you develop goal-directed behavior when you get good grades or you score a goal in soccer, for example. You feel good, so you do that. But when you mix drugs into your brain's chemistry, they just hijack the whole brain because they're just so potent. And the thing is, so these people who have addiction, right? It doesn't make them bad people when when they're addicted. It doesn't. It's this illness. It just takes over your brain. And the kid who's stealing from the parents, when they're actually not intoxicated and when they're themselves, they feel terrible about it. But when they're on these drugs, they're just different people, and that's the sad part.
It's almost like you're starving. You've been running a marathon. You're dehydrated. You want that glass of water. You boulder who's ever in your way to get that glass of water. For sure,
yep. And if they don't do it, they feel terrible. So there's this thing called positive reinforcement. When the more drugs you use, the better you feel. That's when people initiate drug use. But once the addiction kicks in, and you use when you use drugs overall, like for long term, then the negative reinforcement keeps you there. Because when you don't use a drug, you feel terrible, and you just have to have it.
Depressants. All we've talked about is wanting to get high and feeling good. What are depressants, and why are people taking them? If they want to feel good, why would I take a depressant?
Sure. So we've been talking about uppers so far. So depressants would be in the category called downers, the street term for it. Depressants work by slowing down the brain activity and the central nervous system. They can be prescribed by doctors for anxiety or insomnia. Some examples are barbiturates, which are medications used for seizures and anxiety disorders. Some other medications out there are benzodiazepines, such as Xanax, Ativan, Klonopin. They're used for acute stress disorders and also for sleep disorders. And sleep medications such as Ambien, Lunesta, they're used for treating sleep disorders, of course. The thing is, when you take these medications as prescribed, they can be very helpful. However, if you don't take them as prescribed and you take more than you should, or you take them more chronically than you should, they can cause serious health problems, which can lead to dependence and addiction. They can cause slurred speech, disorientation, sleepiness, sedation, respiratory depression, or shallow breathing. You can overdose on these drugs, especially when you also mix alcohol with them.
Why would I want to take it? I don't understand. I'm missing a point here somehow. What am I missing? Why would I want to take this and abuse it? Not prescribed. Not prescribed. I mean, not from a doctor. Why would I want to take this on the street?
Same thing as the other substances that we talked about. It's a quick way to mask your symptoms. It's a quick way to relieve your stress, but then the problem doesn't go away, and the effects don't last too long. They last for maybe a few minutes to a few hours, and then you're stuck back to the same problem you're facing. And then what people tend to do is they use more and more to find relief, but also they become dependent on it. So you need to, for example, if someone's taking benzodiazepines at a certain dose, that dose will only last for a certain amount of time. It goes back to the receptors. over time the receptors downregulate, and then you need more of the drug to get the same effect, and then before you know it, you become addicted to it.
That's horrible.
Yep. In fact, I've helped many people in my practice get off of benzodiazepines, and it can be very difficult. In fact, benzodiazepine withdrawals can kill you, just like alcohol withdrawals can kill you.
Oh, now you're talking about helping people. So, on that subject is a beautiful segue. I walk into Boston Children's Hospital. The place looks beautiful, by the way.
Yeah.
I walk in for treatment. What can you do for me? What happens when I walk in the door?
Sure. So, of course, an appointment is made for an evaluation
Okay.
of a substance use disorder, because I'm assuming that's what you're coming in for,
Yeah.
right? Like, my kid is using substances. What can I do about it? So we have this evaluation process where we have assessments which take place over the course of 3 appointments, scheduled for over a period of 2 or 3 weeks. During these appointments, adolescents and their parents meet individually with a pediatric clinician. Each appointment lasts about an hour. The adolescent will first meet with the pediatric clinician in the first appointment, and at the second appointment, the clinician meets with the parents or guardians.
Okay.
And of course, after this, we have these weekly meetings where the whole team gets together. This includes social workers, of course, medical providers, therapists, etc. And we all discuss the case to see if there's anything the clinician is missing, or is there something else everyone else can add. And it's just a very good, robust evaluation in that sense. And then what happens is, on our third meeting, the clinician meets with the parents and the teenagers, and we discuss a plan going forward. We discuss our impressions, we discuss treatment options and recommendations. This includes drug testing, medications which could help with cravings, for example, for substances, therapy, and parent guidance. So we have a therapist for the parents and also one for the individual therapist or group therapist for the patients. And we also provide education to the families where we talk about receptors and neurobiology, etc.
So after the parents have met for the first 3 counselings with me, are my parents going to be involved in my treatment if I'm a child?
Yeah, we encourage parents to be involved.
Now, do I get treatment from you or just counseling? What do you actually do for me? After I've come in there, you said, okay, you're a candidate, you need treatment.
Yeah.
What roughly will the treatment entail?
Yeah, so we both. Counseling is a significant part of treatment. So we would do counseling, therapy, and also meds.
And if I come in as an adult, I'm 18, just got over childhood, is this confidential? Are you going to tell my parents?
No, this is confidential. We encourage teenagers and parents to work together and for everyone to know what's going on, but it's totally confidential, and we, whatever the teenager would prefer, we do that. However, there are certain conditions where we can't keep confidentiality, which we make clear to the teenager in our first session, which is if they're a danger to self or others, then in that situation we would tell the parents.
Obviously, yeah, you have to protect people too.
Yeah.
How long is, I know there's no magic number for this, but if I walked in today with an issue, what is the shortest period of time or the minimum it takes you to treat someone, and how long can I expect to be there? I know it's case by case.
Yeah, I mean, it's variable. Some kids we even have for a few weeks, but mostly I would say several months to even years, I would say.
Years?
It's a chronic condition. It doesn't develop over one day.
Now, how does your hospital get paid? Do they pay you directly? Do you have insurance? Does it work off a state grant? How does it work?
Sure. So we bill insurance for appointments provided just like other medical services.
So the common credit, the common carriers do it?
Yeah, there's nothing extra that we, yeah.
Okay, say I'm a parent and my kid needs treatment. How as a parent do I convince my kid to get up and go with me to come to you? And this is very important, pay attention to this please, but this is going to happen to almost everybody. The kid knows he needs help. How do we convince the kid to get up and make that journey?
Yeah. So this is one of the reasons I've picked this field, because this is a difficult population. Yeah. If you feel your child may have a problem with drugs or alcohol, use your parental authority to insist that they come in for an initial evaluation. Tell your child that you believe you're taking them to a specialist. It's important for their health care. It is your expectation that they will go to their appointment. We call this using your parental prerogative, which can be appropriate for important issues around health and well-being. The good news is that most teens who are seen for an initial assessment are willing to return, and so your job as a parent is to get them to the initial appointment, right? If all else fails and the kids don't want to come, we can still see the parents, and we'll go over, personalized advice. But of course, if that is the case, and the kid is over 18, we still need the kid's consent for the parents to see us. In a nutshell, that's what
makes it tough on everybody.
Yeah.
Try to do the right thing. Hey, before we wrap up, is there anything you'd like to add that I haven't asked you, and a subject that I haven't brought up?
Sure, and I just want to add a little bit more to how to convince kids.
Yeah, please.
And thank you for giving me the platform for this. So you can provide your kid or your child the best medical providers in the world, the best medications in the world. It won't make a difference unless he or she is willing to participate. It is important to have rapport with your child. So this is where a healthy parent-child relationship and rapport comes into play. It's important to avoid judgment and give them positive feedback. Children have limited insight into the negative effects of substance use. For example, they feel cannabis and vaping are not that big of a deal. It's not like heroin or cocaine, right? That's what they would say. It's also legal, so why not? It's also important to find out what drives and motivates your child. The most important thing I can say. The goals, what goals do they have in life? How will substance use hinder or become hurdles for them or hinder their goals? Many adolescents don't think too far ahead. So in those situations, parents can offer simple short-term incentives like driving privileges, having more flexibility to be with friends, going on family vacations, etc. And if I can speak to the parents.
Yeah, absolutely.
So this is to the parents out there, taking care of kids is a rewarding job, but also difficult, even more so when drugs are involved. You may feel hopeless at times. It is important to know that kids do get better. They reduce and even quit using drugs altogether. I have seen it myself. I would advise you to be persistent, consistent, and set limits. It is also important to watch for the signs and talk to your child early regarding substance use. And of course, try your best to be non-judgmental, although that's hard to do, but that's the best advice I can give you.
Okay, before we wrap up, Doctor, thank you very much for appearing today. This is for you.
Thank you so much.
Make room on your wall. You might be getting a second one of those when you come back.
No, this is wonderful. Thank you so much, David.
Right. Okay, I've got a couple of final words myself this time. Mark your calendars, people. On Thursday, August 31st, the annual Vigil on the Common is taking place. The public is invited at 6:30 to visit the booth set up with information on addiction and treatments. The candlelight ceremony will begin at 7 p.m. This year, I will be there as a little bit more than a guest. I will be handing out, these are test strips. One of this is for fentanyl. The other one is for Xylazine, which is so new, I'm amazed I was able to get these. These were made possible by District Attorney Marion Ryan. I have to give a big thanks to her staff members, Madeline Guerin and Matthew Angeli, for working with me and other healthcare providers by making these test kits possible. This was done through her opioid task force, which meets monthly to go over everything that they can do to try to stop this horrible disease and keep kids from dying. I will also have some kits from the Mass Department of Public Health to give out. So they'll be given out at 6:30. The vigil begins at 7 o'clock. I will not be giving out any during the vigil, but it's a nice ceremony. If you've lost somebody and know someone that's having a problem, this is worth attending. Again, it's Thursday night at 6:30 on the 31st of August on Woburn Common. So, in closing, I would like to thank Dr. Omar Shah for appearing today. As always, thank you for watching. Please share this program with your social media friends. If you or someone you know is suffering from a substance abuse disorder or now a gambling problem, you can contact the Massachusetts Substance Use Helpline, and their number is 1-800-327-5050. This show can be seen on a rotating basis on Woburn Public Media stations, on demand on their website, and on YouTube. As always, thank you for the amazing staff of Woburn Public Media for making this show possible. Please enjoy our closing theme, Rise Above the Noise by Fireheart, and go all the way through the credits. There's important contact information for people from our past shows. For America in Crisis, Breaking the Cycle of Addiction, my name is David Hunt, and thank you for watching.
just cry. There are people who care. Listen to the sound in the air, rise above the noise in the air. The sound not heard is what we bear. Listen to the sound if you dare, rise above the noise in the air. The sound not heard is what we bear. The whispers that I hear behind my back are those who never lost a child, a friend. So they lack a sense of loss, a peace that's gone with no return. Above the noise is how we cope, above the noise is how we learn. The most important things in life I found comes deep within the heart, the purest sound.